Okay, this is Dr. Richard Barwell. I'm the father of neurologically based chiropractic that's now spreading around the world. And this is part of our BrainTrust group where we have asked special people to come on and share some of their experiences through chiropractic and with the neurological base. And I'm really excited about getting Dr. Jonas Marry on here. This is long overdue because this man has been doing some incredible stuff. So let me get some sort of background going with this, and we'll sort of work from where you came from to what's happening with you now. So talk about your education and your years in practice for a minute. Where'd you come from?
I started at Parker. Did my undergrad right here in Pennsylvania, but started at Parker. Finished my BS Anatomy with them and graduated in '99. So almost 20 years in practice in the Pittsburgh, Pennsylvania area.
Oh, fantastic. Wow. Okay. Prior to neurologically based chiropractic that you're sort of got your model in now, what did you practice before?
We basically, or I basically was putting together a mixture of what we got out of school. You know, some of it was technique. Carrick his name was out there at that time. So we were trying to figure out some of the neuro component, but it just didn't exist the way that it does today. The information wasn't there. It was in its infancy as far as I knew. So you were believing in the adjustment by faith and hoping that worked.
That old nerve root pressure, but we knew that wasn't necessarily true, but we didn't have anything else to work with. Is that
right?
So did you ever have any challenges with that when you got into practice?
I had challenges in school. I mean, I actually went to some of the professors that were teaching at that time and said, this doesn't make 100% sense. Is there more to it? What do you have? And very often what we would get would be somebody's principle or somebody's, practice expertise, which is great, but there really wasn't enough science behind that to really sink your teeth into. So the fact that my BS was in anatomy, I kind of tried to push in that direction, understand the anatomy as well as I could. But we stayed below the head. And so, it just turned into, well, there's tight muscles, or maybe there's trigger points, or maybe this is an overuse issue. But the feedback loop was not being discussed in any significant way that made sense to me at that time.
I know that I found that I was not getting consistent results, that if
Right.
it's pressure on nerve, and you're supposed to get results all the time, but the inconsistency drove me crazy.
Correct. I felt exactly the same way.
Did you go and get any practice management programs, or were you involved in that in the early years?
I figured I don't understand the philosophy well enough, so I went and found Dr. Sigafus because he had miraculous events. I loved the guy, I heard him at Parker. I was deep in the philosophy, so I wanted to hear more of what he said, and I totally appreciated it, but it didn't make me practice any better in that regard. I bought the green books and read them and listened to, while we were in school, Kent and Jin Tempo all the time, trying to understand it. But it wasn't having a huge impact on what we were doing in the office.
Did any of that change your technique approach at that time? Like, did you get sort of focused on one technique that?
I really didn't. I have to say, one of the things that I did like about Parker is they taught 10 techniques. And for some people that's blasphemy, and for other people that makes sense. My earliest training of hands-on bodies was martial arts. And even though it was destructive in that regard, we appreciated multiple styles. So coming out of chiropractic school, I appreciated multiple techniques, and I adjusted my technique approach to whoever was in front of me. And that helped, but it certainly didn't solve my frustration.
One of the things I found with the philosophy, and going back to the philosophy, it was great. It kept us, our spirits clean.
Right.
But it really didn't change anything that we were doing, and it didn't answer the questions of, if it's not vertebral subluxation or pressure on nerve, what is it?
Right.
They had pulled the rug out from underneath us at the time, saying, well, it's not really pressure on nerve, but we don't know what it is.
Right. Yeah, and that made it hard to talk to patients, because if you do have somebody who's doing well, then that's wonderful and everybody high fives. But if you have somebody who isn't responding the way that you anticipate, who maybe came in with the exact same symptoms, and you're thinking, oh, I know what to do here, and you are, it's unique to that individual patient, but you're still applying that model and you're not seeing those changes, that's the kind of stuff that would keep me up at night.
I recall a situation where a woman was having a problem, and I offered to give her some care, and we did I gave her care, and it helped her out. And her husband happened to be a medical doctor. And
Right.
he said, listen, he said, what did you just do? And I said, well, I gave an adjustment. And he said, what was that doing? I said,
Right.
well, what am I going to answer? And he said, that's the biggest problem with you chiropractors. He says, not that you don't get results, it's that you can never explain why it worked.
Yeah, and it's true. And I hated I really did not like, nor did I use that garden hose model, because I never thought it was accurate then, but I didn't have a good enough replacement to really say, well, here's what's going on. So, you read what you can, and you have to do continuing education. So you look for people that maybe have a better insight, and you plug in the pieces, but it still really wasn't a complete model.
So what did this do now for instrumentation in your practice? How did you apply what you first learned for having some sort of instrument support to as you were progressing through into your current practice?
I ran out early on. The subluxation station was out at that time, and then the MyoVision was its competitor. And if Kent and Tempo hear me, I don't know what to say, but I bought a MyoVision at that time. The tech behind it I thought was going to be more appropriate and it was better. But all we were looking at was SEMG, which really wasn't very accurate, but I needed something to quantify what was happening. I can't remember the guy whose quote it was, but he said, if you can't measure it, it's not happening. So that's where we started, and it was okay, but it was massively limited as well. People would be better on all kinds of scales, but their SEMGs would still be terrible. We kind of moved away from that after a while, and I continued to research and look for something better.
Okay. Did you do x-rays, or do you still do x-rays?
I do x-rays where they're indicated. I'm not an x-ray for technique person for listings. But I will do an x-ray if it's indicated. I'll do an MRI if it's indicated. I am absolutely dedicated to technology if it gives me more understanding about who's in front of me.
So now you've moved into the NeuroInfiniti. What brought you to the NeuroInfiniti?
I am a huge tire kicker. So like I said, I bought that MyoVision and I was pretty excited about it. And then it really wasn't what I wanted it to be. So I kept looking. And there was another group out there. Coke has Pepsi and Ford has Chevy, and the NeuroInfiniti has somebody. I don't know who the other people are anymore because I'm not sure they're even around anymore. But I researched for about a year. I remember talking to Dee Dee and Carrie Ann and them both saying, what is taking you so long? This is what you want. Let's go. You're going to love this. And I looked and looked and looked. And after I did all the research, I got it, and we put it in use the week we got it. And it changed everything because it changes the conversation.
Oh, go ahead and elaborate on that one.
Okay, so my attitude is this: if I'm walking up onto any environment, any situation, and I need to know more about it, I liken it especially when I'm dealing with a patient to, I need to know more about the house, but I don't have the key to the front door. If I'm going to get as much information as I can, then I better have access somewhere. So being able to look at, okay, we have an SEMG, but it's in context now. We have a brain readout. We have an EEG component. We have heart rate variability, which has research behind it, for decades. We can look at heart rate. So now we can quantify autonomic responses. We can see where brain activity is. And now we're also having the ability to corroborate those other findings, whether those were in my physical or those were X-ray or MRI, or even if it was a blood test. Now when we sit down with patients, we're giving them 3, 4, 5 layers of information that all say the same thing. So the question isn't, do you want care? The question is, how much care do you want? In other words, do you want to correct what's going on here, or are you looking for palliative care? And I say that to them just as bluntly as I'm saying it to you. Here are your options. My job is to explain to you what's going on, and we have the technology to demonstrate that and to follow up. So not only can we show you where those changes are, but we can show you what those changes look like as you get better. And we'll take this as far as you want to go. You can talk about filling in the hole that you came in here with, or we could build a skyscraper. What's your goal? Once we have that kind of information, the conversation with the patient changes immediately.
That was like a 15-second dialogue to change the conversation.
Yeah, really. Sorry about that. Yes, it makes a huge difference. Patients, we're seeing concussion patients. A lady called me the other day and said, my daughter has this rare disease. Can you help her? I said, bring her in. Let's evaluate her. If she's got something going on neurologically, yes. We're not here to. I think it's so important for chiropractors to understand why we say we don't cure disease. Because I think a lot of people see that as a cop-out. Well, we're not going to cure your disease, but the disease, that named component, is only the outgrowth of the underlying inefficiency that exists in that nervous system. So I think that's such an important perspective to be able to say to that individual, neurologically, you're inefficient. Here's how we're going to change that. As we do, here's the changes we expect to see in your physiology, and here's why. And if we don't, we can go back and evaluate why for that as well. But honestly, it's not too often that we don't see those changes because we started in the right place because we had the information.
Wow. You know, we always hear this, the challenges that we hear about this, people look at it and they go like, oh, it's going to take too much time. You want to address that issue?
I remember coming to one of the first trainings and listening to a guy say, and in fact, I think you called him out on it. How long have you had the unit? A year. Have you opened it up yet? No. It's a little intimidating to think about that and think, I didn't really learn enough about EEG in school. I'm not sure I can talk about this. But you have to jump in. You have to get your feet wet. You have to get to the training. And once you do that and become more comfortable, and you're only going to get comfortable by using it, then you can begin to put it in words that are comfortable to you and in a way that patients understand. It's not that hard. You just got to be willing to take that step. But the difference, the payback that you get from it is significant, because if you miss that opportunity and that child then doesn't get care, then what's the outcome? So it's not about us. It's about, if I don't have this conversation and be able to have this kind of discussion with a parent who walks away understanding why I said I'm going to adjust their neck even though they came in here because their stomach hurts, that's a big deal. And when they can see where's and why's and how's and get on board and not blink an eye at it, that's huge.
Do you have any problem with patients understanding what they're looking at?
No, but I will tell you this, and Dr. Joe Demian cleared me up on this. I was giving people I was going over their report and their report of findings without doing a doctor's report in a way that reviewed the technology. And so that was an initial hurdle for me. And he goes, what are you doing? This stuff is on a different level. They need to have a baseline for what you're talking about. So I immediately implemented the doctor's report, which is just talking about each facet of the testing, why we do it, and what chiropractic is. So that orientation became my orientation for everybody, because we scan everybody who can get scanned. There's nobody that comes through the door that we're not going to evaluate using that technology. So once we've started to be able to get them into the doctor's report, which I just made mandatory, I can't do your report of findings until you do the doctor's report. And we put it on video and put it on our website, because you always get the story from people who say, I'm too busy, I don't have time. Great, I videoed it, it's on my website, watch it. So we don't have that issue anymore. People will watch it, they'll come in, and when we sit down, they're primed and ready to go. So no, we don't have that issue.
Fantastic. How long does it take you from what you were doing before and when you brought the NeuroInfiniti in? What was the time difference as far as the examination? Did it make any difference?
Adding that piece, 15 minutes, and I actually have a staff member do it. I used to do them all. I got a staff member in, trained her. She's actually faster than I am. So it's 15 minutes. So she's doing that while I'm adjusting people. When she's completed, then that's when I start my end of the new patient exam. And it doesn't add any time at all because I delegated it.
And meanwhile, while they're doing that, you're doing what you need to be doing, and that's adjusting patients.
Correct.
Yeah. So you got income going in both directions now.
Right. It's a no-brainer.
Yeah. Say that again.
It's a no-brainer.
So talking about the concepts of neurologically based chiropractic, based opposite to what we were raised with the bone-on nerve, somewhere along the way, and this has been 20 years I've been doing this now, that light bulb goes on with people, and I that's a great moment for me when I can see them sort of sit back in the chair and go like, oh my gosh.
Yeah, there it is.
What happened with you at that moment? What was it that turned your light on?
You know what? I think it was my story getting into chiropractic. When we got to school, and I don't remember who asked us this. It may have been Neil Stern, who was the vice president of the school. He came in our orientation and said, "Why are you here? How many people in this room are here because of something that happened with them?" And it was about 90% of the room. I got very, very sick as a 19, 20-year-old. And it was an intestinal issue. And they actually hospitalized me for it. And I was losing weight, not doing well, and having all these issues. And they let me go. I said, listen, you guys don't know what's going on. I'm not any better than I was. Let me out of here. So the nicest doctor in the world, who was tired of dealing with me, he let me out of the hospital, and I called my chiropractor, and he adjusted me. And that evening, probably not the best choice, but I was eating pizza. So there was this switch that I went, hey, this is bigger than I understand. But that got me in and said, there's a bigger concept here than we realized regarding health. But when I started to see some of the work from people like Bobby Dosher doing work at Oklahaven and seeing these kids come back on, I still didn't understand where it was coming from, but I started to understand there's got to be more to the nervous system component to this. So as I was researching through and I finally hit NeuroInfiniti and went, oh, there's an extra piece here we can actually look at. That's when things started to make a little bit more sense.
Fantastic. So what's happened to your practice since you made this turn?
Our compliance is 1,000 times better. I mean, I'm by nature an educator. I will sit and talk to anybody about chiropractic for as long as they'll sit there with me. But that compliance piece is better because our initial conversation is foundational. So they're not having to believe with me for unknown reasons that the adjustment will probably work. They're sitting there understanding what's going on with them neurologically, how they got to where they are, and what we're going to do to change that. So now it becomes, we link up and start stepping forward on that process together. And they don't totally understand it, but they have such a better understanding of the basics that they can ask questions that allow us to go forward in a way we couldn't do before. So when they're asking those questions and actually getting answers for them, and then when they're in the room doing biofeedback and I go, look, that's why we're doing that. Do you see that change? Do you remember when we did your evaluation? Do you remember when we talked about that? And they see it, they're starting to link those concepts up. So each day is a mini re-educational point for them. And when they're doing bioneurofeedback and seeing it happen, it connects it for them. And I think that makes that compliance piece go way, way, way up.
Fantastic. Now, I know that, well, you mentioned neurofeedback and biofeedback. So
Yeah.
Obviously you're doing that. Now, you know that Heidi Havoc hit that magic number of that 20-minute window, which when I first heard this, I was lecturing in Sweden and we were sharing a stage. And when she said this, I about fell off my chair because the original research that we did with the psychologist, we picked a 20-minute time period to do the neurofeedback retraining programs. And it was like, oh my goodness, we just arbitrarily picked this.
Right.
Here it is being a critical time period. And for people in chiropractic practice that are adjusting people, sending them back out into their junk that's created their problems in the first place,
Right.
and not doing anything in that magic moment. So now you're applying that biofeedback and neurofeedback. Anything else that you're using?
We are using, we're using a lot of proprioceptive modalities, whether that be a simple wobble board or vibration therapy or a vibration plate, bounce and coordination drills, cerebellar exercises. There's a variety of technology that we're pulling in because what I tell the patient is, look, the whole point of me adjusting you is to turn your brain on and prepare for what you need. What we do after that is how we get that plasticity component in place. That's how we get that brain to change and maintain those changes, because you walked in here with a pattern. And I'm not here to move your bones around. I'm here to assist you in changing the pattern that you have, because the one you developed isn't very healthy. It's not efficient. So we're going to change your efficiency by doing these things. So everybody that comes through the door is doing bioneurofeedback or some other modality to take advantage of that window that you're talking about.
Fantastic. Now, do you have a diplomate in neurology?
I am currently involved in that program. I have 150 hours in. You need 300 to take the test. So we're halfway. I'm completing the other half with Dr. Malillo, who does a lot of the pediatric component. And we see a lot of families and a lot of kids. And that's the other place I think this is so important, because I just had a lady in the other day who knows chiropractic well. I've seen her in the past. She was in an auto accident. She was at the ER. Her child was in the back, 5-point harness. And the ER doc said he's fine. Now, he didn't evaluate him. He just looked at him and said he's fine. So she came in and we're having a discussion. And I said, how can he be fine? He was in the same car you were in. And his body is less capable of dissipating force than you are. Plus, if he's in that harness, his neck takes the majority of that abuse. And she kind of opened her eyes and thought about it for a second. And she said, but he said, and I said, here's the difference. He's looking for pathology. We're looking for function. And it's great there's no pathology, but we can't ignore that functional piece. So that's why I wanted to work with Dr. Malillo. He really goes in depth there. But what I'm finding is all of the neurodiplomate information gives you the information to know where to do the bioneurofeedback. So if that person shows up with a parietal lesion or a frontal lobe issue or a cerebellar problem, you start directing your care accordingly, and you get faster results.
Fantastic. IAFNR group and Dr. Melillo are a class act. They are really, really a great group. I know I've spoken there a couple of times, and I really enjoy that whole group. So good stuff. But the point I want to make with this is, people think that you have to have a diplomate to begin this kind of work.
No.
And this is the stepping stone that you can begin neurologically based chiropractic using neurological function without having to do the rest of the program. Some people want to go on like you did, and congratulations. I think it's a great decision.
I'll tell you, we have talked about this. They're not talking about EEG yet. And I think that's a big deal. So, we have this phenomenal group of brilliant people. And I've been in the classes where somebody has said something about bioneurofeedback. And the answer at the time was, well, it's one of the things we're looking into. Neither one of us are well versed in it enough to really talk about that piece, which is good. That's an honest answer. But it's not as good as functional neurology is. We still need this other piece. So you don't have to have it by any means. You can start without having that piece in place. I did, and how many other people have. But if you do go down that road, they dovetail perfectly, and that piece has not been fully explored there, and it needs to be.
I think I'll be giving Dr. Melillo a call.
That's a great idea.
Talk about education stuff. You've been doing some pretty interesting education stuff.
That group offers you the opportunity to go in a lot of directions, from rehab perspectives to just having a better understanding of what that subluxation actually is, how it's affecting the brain. Dr. Brock had stated right in the very beginning, and this really caught my attention. He said, subluxation, if we were really going to talk about it and really define it simply, it's a movement disorder. And I really like that language, because we have to talk about what the brain down is doing to the body as a whole, and then what the body up is doing. And since 80% of your nervous system is afferent anyway, since all that information is going, if you can't process it adequately, and that's where you get the opportunity to really dig in there and get your teeth in, you get so clear about what those loops look like. So you have a local issue, hey, my pain's here, but you have a global pattern that's present. And if we're not going to address both, and you need the education to do that, then I don't think people really get well. And then you have people that walk around with that model that say, well, chiropractic's okay, but once you go, you got to go for the rest of your life. And they think that either because their pain comes and goes and they're treating pain and they don't know what's really going on, and the doctor doesn't, or nobody explained to them, you don't have to go, but if you want to be healthy, you're going to stay going to the gym, you're going to stay eating good food, so I think being able to really understand all those pieces better lets you answer those questions better, and I think more succinctly to patients, and they walk away with more understanding so they can make a better decision ultimately.
Oh boy, having the patients make better decisions is the key, and they only can do that with education.
I agree.
Unfortunately, the only education that they have about chiropractic is what we started years ago, talking about pain relief,
right?
Where they make their judgments from. So we have to be a source of importance to them. So the bottom line in all of this, we have challenges that when we are trying to talk to chiropractors and get them to make that shift.
Right.
The philosophical challenge that they are still bone on nerve, and that they really are fighting this. We have that particular group. We have the next group that are really interested in this and love this, but go like, gee, I think this is a big cost. They don't see it as an investment, or they understand what kind of return comes from it. And then we have the third group that just says, I'm too busy, I can't bring this in. So want to address those three issues about what your thoughts are on them?
I was hoping you were going to let me say that. I don't think you can practice chiropractic if you don't get this information down. And I think if you aren't doing this, you're doing a disservice. I'm willing to be, that cut and dry about it. I don't think you can truly go forward treating people without really knowing what's going on. That's number one. And two, as chiropractic goes forward, there's going to be that core group that's always been there, regardless of what side of the fence they're on. But this neuro component is going to become the core group, because it tells the truth and explains what's really happening. And that's being demanded anyway. So I think if you don't get this information into your office, one, you're going to be left behind, and two, your practice protocols and procedures are so antiquated. I don't know who would want to take part in that. So you have to do it, or you do a disservice to yourself, the profession, and the patient.
Okay, what about the next one? What about the fact that it's a cost versus investment? How's that worked out for you?
Your cost, I recoup my cost in less than the first year. Here's the other thing, and it's what you said, it is an investment. And I mean, any technology you bring into the office does two things. One, it sets you apart as a doctor that we just talked about. You're doing something at a different level, and I think people are looking for that. Especially since insurance is changing and consumers are more often responsible for their care. So they want to know what they're getting is good, up to date, and accurate. But I don't think cost, I think you have to look at that as an investment, just like you would education on any other piece. Not only are you getting the unit, but you're getting the training that's going to give you the ability to have a better conversation. As I said before, compliance goes up. So you're keeping people longer because they understand better and they're referring. So that one's a no-brainer too.
Okay, and the last one was, I'm really busy, I don't have time.
You're a slacker. I mean, I don't know what else to say. Everybody's busy. If you want it, you'll find the time. And I think if you really are intent on doing a good job and being that doctor of the future that we all quote, I don't think you can go forward and not make the time to get a better education about what you need to do and what's going on. I don't see how you go forward that way.
I know that Dr. Rich Applin, as you know, is our lead instructor, did this, had practice that is just absolutely slammed. And he was doing the scans by himself for a long time. I finally convinced him to hire somebody to do the scans. It only took me about 4 years to get him to do that. But he was doing it by himself and running an extremely busy practice. And I know that his new patients, he's booked like 3 and 4 months out for new patients. They just can't get into them. That sounds like an income positive for a practice to me.
It's an easy thought process. So let's say you're starting out and you're looking at the cost relative to your overhead, whether that's what you have to pay for your office, your insurance, or anything else. Okay, then that I understand. Maybe you need to get some time under you, but you still need the information. But that's something I would take a loan out for. I mean, I just would. It's worth it. The technology is proven. And as I said, it gives you the ability to have a conversation you can't have with other people without that technology in place.
I think about when you said you had this thing paid for within the first year, and I think about, oh my gosh, I go back and buying an X-ray machine.
Right.
The first year that I ever got recouped money on, I never recouped the money on that thing.
Right.
You know,
Yeah.
So it was just ongoing. That's pretty awesome when you think about it. So that's incredible. So my final question for you is just, you're on a journey. You know, you're on that wonderful chiropractic journey, and where you started from back at school and what you learned to where you are today. How's that feeling for you? How's the fulfillment for practice?
It's phenomenal. The reason for that is we had a kid in the other day. He had a depressed skull fracture. So this is not back pain. This is not headaches. He's 10 years old, wrecked his motorcycle, and he's got a hole here. So he comes in and he's been released from his neurologist. He's back to activities. And I said, walk for me. And his walk is the most disorganized walk I've ever seen. I said, run. I said, jog for me. He looked at me and said, what is that? I said, just a slow run. So he tried, and again, horribly disorganized. So because we had done the exam, because we knew what was going on with his brain, because we saw all the rest of his records, we adjusted him, did the appropriate rehab, targeted the brain regions that needed to be targeted. And in 10 minutes, that child was walking almost 100%, and he actually had an organized jog. That's the fulfillment piece, because that child's released, he's completely disorganized. And if his motor system is disorganized, then his sensory system is, which means he's just as disorganized in his thought process and his ability to learn. That's a huge deal for a 10-year-old kid who's going to grow up potentially thinking, I'm not good enough, or I'm not smart enough, or I'll never be good in school. And none of that's true. He's just disorganized. So for the philosophical people who want to talk subluxation only, and I get that, but it's disorganization in the system. When you change that and you see that kid go from that to that in the matter of 10 minutes, then what else do you need to know? It's worth the investment of your time, your money, your effort, whatever it happens to be. If you're really there to serve, and I think as chiropractors, I think we really are that, then you get it in spades.
Well, Doc, you're one of our stars in neurologically based chiropractic and the NeuroInfiniti application, and I'm proud of all that you have done. And I'm really glad to have you on the BrainTrust. And I want to say thank you very much for your time. I want to come back and visit you again with another set of questions. So we'll set that up for somewhere down the road. And in the meantime, carry on doing a great job. And thank you for your time.
Thank you. I appreciate it. Thank you for all you've done.
Thank you.